The listening part of the Occupational English test has 3 parts, and in each part you hear a number of different extracts. At the beginning of the test, you will hear a beep sound. You have time to read the questions before you hear the extracts. You will hear each extract only once. You have to complete your answers as you listen. At the end of each test, you will be given 2 minutes to check your answers. Part A. In this part of the test, you will hear 2 distinct extracts. In each extract, a healthcare professional is talking to a patient. For questions 1 to 24, complete the notes with the information you hear. Now look at the notes for Extract 1. Extract 1, questions 1 through 12. You hear a physician talking to a new patient called Bernardito. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Good afternoon, doctor. I am Bernardito.
Good afternoon. May I know what your problem is?
I am having a severe stomach ache.
What do you feel?
I have heartburn and severe pain, doctor.
Since when have you been feeling this acidity and pain?
For the past 2 months, my stomach hurts after every meal. The pain persists even during nights.
Have you eaten any heavy food or something different in the last 2 months?
No, actually.
How severe is the pain? Let's say on a scale of 1 to 10, how would you scale the severity of the pain?
Well, I can say between 4 to 5.
Is the pain continuous?
No, it hurts only fleetingly.
Do you feel the pain after meals?
Yeah, probably because it hurts every time after I eat.
Is there any kind of food that bothers you much?
Yeah, greasy food.
Oh, I see.
Yes, at home we eat a lot of greasy food.
Where in the abdomen does it hurt? Tell me the exact point. Does the pain shift to your chest, shoulder, back, or across your abdomen?
It hurts in the middle. At times the pain moves across my abdomen.
Besides the pain, you said you have heartburn?
Yes, I feel a kind of sour taste whenever I burp.
Do you feel like this more during the day or in the evenings?
Both. I feel the acidity during the day and at night.
Is it getting worse whenever you lie down?
Yeah, I get an acid-like taste in my mouth.
Besides greasy food, are you getting some irritation in your stomach when you eat in any other kind of food, like spicy food?
No, actually, we don't eat spicy food at home.
And tell me, how frequently do you have a bowel movement?
No, it hasn't changed. It's regular.
And tell me, how frequently do you have a bowel movement? And has there been any change in your bowel movements for the past 2 months?
Yes, it has become a little bit softer.
Is there any change in the color?
Yeah, it is greener.
Greener and not darker? Any blood in your bowel movement, or is it darker?
Not darker. And there wasn't any blood in my bowel movement.
Okay, let's first diagnose your abdomen to check from where the pain comes. You said you are feeling pain at the middle part of your abdomen.
Correct.
Does the pain stay there only, or does it move somewhere else?
It usually stays there.
Do you feel acidity and heartburn during the pain?
Yeah, you were right.
Do you have vomiting or nausea?
No, not now.
What did you eat today?
I ate meat and tomato sauce.
Do tomatoes give you any trouble?
Not exactly. I have been eating tomato sauce always.
Do you get any trouble when you have orange juice?
Yeah, at times.
How do you feel then?
I get a strange metallic taste.
You do not feel acidity then?
No?
Now, tell me, what do you do whenever you get stomach aches?
I take Alka-Seltzer at times. That gives me a relief from the pain to some extent.
Yeah, that should help with the relief. Do you take any Maalox, Tums, or Mylanta?
No.
Have you ever taken any medication on a consistent basis, such as Advil, aspirin, or Motrin?
I was taking Tylenol usually.
Okay. As I told you earlier, I'm going to examine your feces to investigate whether you have any kind of parasite. Tell me, Do you either come from the tropics, or have you ever been traveling to any of the tropical regions or overseas?
Yeah.
Parasites that are found in most of the parts of the world affect the stomach. Besides, I want to check for any occult blood. You have mentioned earlier you haven't seen any changes in your feces, and it's only greener and not darker. Sometimes, if you have a hemorrhage in your stomach, then the digested blood could produce a chemical reaction so that you can have occult blood in your feces. In such cases, we don't see the red color or dark color of the digested blood. Therefore, a diagnosis is essential. Moreover, I would like to diagnose your upper gastrointestinal system through x-rays and contrast. You will be given a thick substance to drink, and then the radiologist would observe how your liver digests the substance and observe your stomach movements. Because I think that your pain comes from your gallbladder and not from your stomach, I will have to do this kind of diagnosis. After a thorough investigation, let me decide whether I should take the x-ray test or an ultrasonic study of your gallbladder. Do not eat any greasy food for now, and also do not have your dinner just before going to bed, because it could produce more acidity. Eat normal food and nothing spicy. I shall get back to you as I receive your medical reports from our lab. Anything else?
With so many medical tests, I'm afraid I have an ulcer.
I too have that kind of doubt. That is why I have suggested all these tests. I need to explain to you that an ulcer or other irritations in your upper intestines cannot be detected by x-ray at times. If the pain continues after having some antibiotics, you may have to go for an endoscopy. An endoscopy is a medical investigation in which a tube will be inserted through your mouth or nose, and then the specialist will observe your stomach, from the small intestines to the large one, and your gullet. Do you need any clarification?
No, doctor, thank you.
Good. Let us meet next week. Goodbye.
Extract 2, questions 13 to 24. You hear an optometrist talking to a patient called Dominica. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Good morning, Mrs. Dominica. How can I help you?
Good morning, sir.
Can you show me your registration card? Or should I search your details through your mobile number?
I think that would be better. My mobile number is 078-823-78979.
Okay, I've tracked your record. You last visited on the 27th of August 2016.
That's correct.
Just pay the doctor's consultation fee here.
Sure, this is my card.
Please take your seat and feel comfortable. Should I help you with water, newspapers, etc.?
Thank you. Hello, doctor.
Hello, Mrs. Dominica. So how can I help you?
I just came for a regular checkup for a suspected case of glaucoma. 18 months ago, Dr. Gonzalez advised me to undergo a precautionary checkup once a year, knowing my family history of glaucoma and after examining my eye. He told me that my optic nerve is thicker than the usual.
That's probably the reason you were asked to undergo a precautionary checkup every year. You can have the visual field analysis and OCT today. And once you receive the 2 test reports, let's meet again in the afternoon.
Okay, doctor.
Yes, Mrs. Dominica?
Hello, sir. The doctor advised me for these 2 tests.
Okay. The 2 tests would cost you £200, and you'll get the test reports in around 3 hours. Is that okay with you?
That's fine.
Please be seated here. Someone will call you back for the first checkup in just a few minutes.
Thank you, sir.
Hello, Mrs. Dominica. I hope you had a good experience going through those 2 tests.
Yes, it was. And since I've taken the test before, I know what to expect.
Your test reports are perfectly okay. Since these reports haven't shown anything suspicious in so many years, I think you can now take these tests once in 2 years and not every year.
Okay.
Well, that puts the glaucoma thing to rest. Do you work on the laptop for long hours?
Yes, doctor. Being the chief accountant, I have to work all day on computers.
If your eyes become tiresome very quickly, I will recommend an eye drop that can be applied thrice a day. Generally, the eyes become tiresome when we continuously look at the computer screen without blinking for long. In such a case, this eye drop would lubricate the eyes.
Actually, I see a few black, thin, wavy structures floating before my eyes that don't disappear even after closing my eyes. What are they? Will it cause any serious problems to my eyesight?
Not actually, they're called floaters. As we age, floaters develop to different extents. They're not harmful. Actually, floaters may appear like gray or black specks, cobwebs, or strings that float during eye movements and appear to break away when you look at them directly. Generally, most eye floaters are caused due to age-related changes that occur as the jelly-like substance called vitreous inside the eye becomes more liquid.
Are they very serious, doctor?
Getting a new floater or the appearance of light flashes are the signs that the vitreous gel is pulling on the retina that can lead to a retinal detachment, a serious condition that can be treated with a surgery.
Can anything be done about the floaters in the eye?
Rarely, floaters may become very dense and plentiful and affect the eyesight. In such cases, a surgical procedure called vitrectomy may be suggested to remove floaters from the vitreous. A vitrectomy is performed to remove the vitreous gel along with the floating debris from the eye.
How can I get rid of floaters, doctor?
Normally, most of the eye floaters don't require treatment. It requires some patience and caution to get rid of them over time. When floaters become so large or numerous, they can impair the vision.
What kind of vitamins will be effective to treat floaters?
Although our government doesn't approve the Food and Drug Administration for treating floaters, there is anecdotal evidence that intake of vitamins can improve the eyesight and reduce the dominance of floaters. You can take a vitamin A supplement that includes selenium, magnesium, and DHA, as these nutrients help to treat floaters.
Can you suggest to me some foods that will be effective to control my eye floaters?
Well, you can indulge leafy green vegetables like spinach, kale, and collards in your meals. You can also have salmon, tuna, and other oily fish, eggs, nuts, beans, and non-meat protein sources. Citrus fruits or juices such as orange, oysters, and pork in your diet.
Thank you, doctor. Thanks for your time.
You're welcome.